Good morning, everyone. I'm Lisa Jenkins. I work with the Tennessee Department of Health, and I'm responsible for grants coordination and strategic alignment. My co-lead, Kathy Wood-Dobbins here, will be up in just a minute, and I'll let her introduce herself at that time. Before I acknowledge the members of the committee, I just want to say that our committee, I'm a pretty hard driver, and they worked really hard, and I was very pleased that in our very large committee, we had 24 members and even some people that we pulled from other committees along the way. And we met weekly, and we had a lot of work in between, and they stuck with us all the way through and did an excellent job, thanks to the work of Tim Cross, who's the facilitator for our team, who set up an online thing for us to be able to share information. They really did a good job, but we had a very, very large job to do. I'm sure all of you know that Tennessee does not rank the best in the country for our health status. And our commissioner, this is an extremely important initiative for him. He and I and others at the Department of Health are extremely committed to the issues that are faced by the residents in rural communities in particular, who not only suffer from some of the worst health problems, but also have a lot of times the fewest resources available to them. So we had to really balance several considerations as a committee. Every employer we know wants a healthy workforce. That's one of the major things that they're looking for. And of course, those people who are potential employees also want to be healthy. But it has to be services that they can access and services that they can afford, and that is not always the case. They also need to make responsible choices about their health, and that's not an easy thing to do when we are someone who believes very much that people have the responsibility and the right to make their own choices for themselves. The other reality is that in these rural communities, the healthcare professionals who work there have some of the higher per capita incomes in the county. And the health businesses, the health services, are some of the larger employers in the county. And so it's an important economic base, but none of us wants to continue paying more and more and more for healthcare. So we really had to look at the balance between healthcare services that are available and the things that help us be healthy and maintain our health and make us less dependent on those healthcare services. So I want to acknowledge the members of the committee for the challenge that they took on and for their willingness and their immediate understanding that this is not just about making sure that healthcare services are there to treat the people who are sick, but also that we need to look at health and how to prevent being sick and maybe shift some of the economics that are going into healthcare services more onto the side of the things that keep us healthy. So let me just stop and acknowledge the members of our committee, and then I'll bring Kathy up to speak up to some of the things that our committee really felt to be important. Again, I mentioned, and I'd like for the members of the committee to stand. Unfortunately, several of our committee members were not able to make it today, but we have some, and we borrowed from other committees as well, too. So, okay, and I'm going to ask Kathy to come up now and kind of walk us through the first three of our recommendations. Let me say first that our committee formed initially. We looked at all the recommendations that came out of the task force presentations early and considered those along with other ideas that we were aware of. We were lucky to have people who are pretty plugged in with what's going on nationwide. And we formed 4 work groups, and everyone could participate on any of the discussions they wanted to. But one of the things that was really important for us to consider was not just does this improve job opportunities? Does it offer higher income for people who are employed? Or does it bring revenue into the community? But we added a 4th indicator. Does it improve health status? So we felt it was really, really important as we were looking at the metrics to also look at the health indicators that are there and to look at, for our measures, the data that's already being collected and where our counties are being compared, not just within Tennessee, but nationwide. So as we go through these, you will see the metrics. For those of you that are at the table and were participating, we actually compiled data specific for each of the counties that we were looking at, the distressed counties, around not only their health indicators, but also kind of the process indicators that we hope to do. So you will see, and I will refer to, I don't want you to spend tons of time looking at the data there, but we kind of looked at how do the 21 counties we're charged with addressing compare to the rest of the state average, and also which are the counties that are where the need is the greatest. And that was really a primary consideration in our recommendations. Kathy.
Thank you. Good morning. My name is Kathy Wood Dobbins, and I work as CEO of the Tennessee Primary Care Association, which is an association of community health centers or federally qualified health centers, many of which are in these 21 counties. As we looked at these counties, there are several things that really stood out to us about these 21 counties. They have much higher rates of uninsured than other counties in Tennessee. Many of them are seeing their hospitals close, and several of the counties do not have hospitals. We also saw that these counties struggled to recruit and to retain the healthcare provider workforce that they need. It's difficult to recruit physician practice to one of the economically distressed counties. And also we know that many of these counties, the residents have much poorer health outcomes. They're not as healthy as people in other counties as well. So that was some of the reality that we looked at, and we were particularly concerned with the closure of hospitals and the strain that that's placing on the emergency medical systems, not only funding that, but the need to take people to other counties. So we began to look at action items, and our very first action item is around what we call a mobile integrated healthcare system. And basically what that means is that we have to utilize the resources that we have in these rural counties to the maximum. We have to really look at what are the best practices across the country, and what are some things that we might be able to bring to these rural counties. The first one is an integration of services, and I know in many of the community health centers, there is now not just primary care, but behavioral health care is being integrated, and maybe bringing in dental services. So where there are health services, the more we can integrate, particularly behavioral health care, because there's a lot of need there. A second area is in telehealth. Telehealth is a way of using technology in order to bring certain services into the county. For example, if there's a county that, a healthcare provider in the county that could use telehealth to bring psychiatric services, perhaps, a consult into the county, or an endocrinologist for their diabetic patients. So really maximizing the use of that telehealth capability. And then a third idea and recommendation is a program that was actually new to me before I worked with the task force, but is very exciting and very interesting, which is community paramedicine. And that is really looking at ways that with training and with medical oversight, we can maximize what EMS workers are doing so that they are not only transporting patients back and forth to the hospital, but with the training and the oversight, they might also be able to address folks that are frequently using the emergency room and redirect them to primary care. They might be able to connect them to necessary social services or other community resources, and really kind of build this mobile integrated healthcare system in the communities that is maximizing what everybody can contribute and maximizing technology through the use of telehealth. The second thing that we looked at was access to health care. And while we don't have a specific recommendation to bring, I do need to tell you that the committee unanimously wanted to express that increasing the rate of insurance in these 21 counties would really be the game changer. I mean, that would be a change that would really help to stabilize a lot of the healthcare system, the hospitals in the county, and also would make a tremendous difference because of the large number of uninsured Tennesseans that are living in poverty and that live in these distressed counties. Another area would be to improve the number of healthcare providers, physicians, dentists, advanced practice nurses, mental health counselors that would be available. So in order to increase this, in order to increase this, one of the things that we are recommending is really building on a program that has been very successful in Tennessee, which has been providing incentives for health professionals to locate in rural counties. That incentive program is in place. It is both scholarships, some loan repayment. Physicians come out of medical school owing a lot on school loans, as do other health professionals. And so those incentives can go a long way in allowing for some loan repayment in exchange for a commitment to that community for a certain number of years. And right now, the program that we have is anywhere from 10 to 15 incentives, and we think that by possibly doubling that we could really begin to make an impact on recruiting more healthcare professionals to those 21 counties. And this provides just a bit more detail about those incentive programs. We do think that it's important that as we provide those incentives and look at loan repayment, that there also be an emphasis not only on providing healthcare services, but engaging in the total wellness of the community and engaging in prevention activities as well.
And I get to talk about the fun recommendations, which have to do with the prevention side of things. So our commissioner talks about the big 3+1, which are the behaviors that we have that all of us probably don't do as well as we should, that lead us to developing some of our leading diseases, diabetes, heart disease, et cetera, related to the food we eat, the exercise that we do or lack thereof, and our use of tobacco and alcohol and other drugs. So the big 3+1 are things that we pay a lot of attention to in the Department of Health. And I was really pleased. Thanks very much to our folks at UT Extension and also to the Department of Agriculture. We have some tremendous resources already being invested in food here in Tennessee, particularly through agriculture, nutrition, et cetera. We have some really excellent farmers markets. I was a little dismayed to find out that in these 21 counties, there were 7 counties that do not have any kind of farmers market. And when we delved down into that a little bit more, we also learned that not only do they not have farmers markets, but their grocery stores don't really have a lot of produce. Most people have to shop somewhere that's almost like a convenience store. So food deserts, as they're called, where people really are not within 10 miles of a facility that serves healthy food, is a real concern in these counties. So we would love to see expansion not only of some kind of farmers market in these communities, but also expansion of the farmers market that currently exists. I personally love the idea of a mobile farmers market because I have this vision of a public-private partnership that could result in a vehicle that kind of is one morning here and another morning there. It markets the food that the farmers produce. It takes it to where the people are if they're far and don't have transportation. And particularly if we can expand the access for the people who receive those supplemental nutritional benefits like SNAP or WIC, or the 2-for-1 programs that some private foundations are now offering. If you buy fresh vegetables, you get 2 for 1. The farmer gets paid for 2. You get two, but only one of your vouchers is used. So we love those ideas. We think there's lots of opportunity to expand. It not only helps improve the health, but it actually increases the affordability for the people who are purchasing the food, and it is income, additional income for the farmers, the growers, the distributors, the people who are actually the source of the food. We have a lot of opportunity there, and so we have lots of partners there. That's a good thing. And I was really impressed. I just want to give kudos to the Department of Agriculture and the Pick Tennessee Products. Excellent site. A lot of the research and data that I got there, available online. You can find who has it, what they're selling, when they're open. That's a great resource, and we should encourage every one of these distressed counties to make sure that they're adding some of their local producers and growers on those sites. Also, for prevention, we talked about physical activity a lot. And in rural counties, they're probably among the most beautiful natural areas in our state. And we spend lots of money promoting them to tourists to use our trails and our parks, right? The sad thing is that not very many of the people who live in those communities actually use those amenities as much as we could. So we are encouraging physical activity through promotion of the spaces that we have, the parks, the trails, the playgrounds. Not to say that we can't certainly use more, and there are lots of funding sources and partners through TDEC that help local communities build their parks, TDOT that invest in parks and trails and bikeways for alternative transportation. What we need to do is to encourage the programming for that for the people that will get the local residents out and get them physically active as well. So whether it's walk to school, safe routes to school, or events that promote better health through physical activity, or tourism events where you bring the local residents out too, maybe it's a buddy program, we would really love to see increased physical activity. And we also see opportunity there for some small businesses to be created or expanded as support for services for those that are using those physical facilities, those activities. So bike shops, I don't know, fitness facilities, maybe some of the additional kind of clubs. You can get out and walk and run for no cost almost, right, for the user. But we think that there's plenty of opportunity for some small businesses to also grow around that. So we're looking to all of those partners, including lots of private sector partners. I personally was involved in my civic club in my community in helping to build several playgrounds and do improvements on our green belt and other things. So I know that you can get the private sector involved in this as well. And we could certainly look to hospitals and businesses to help. Employers want those kind of amenities for their employees, as it's good for them too. That's the kind of community people want to locate in. So in closing, I just want to say that we want you to think not only about the impact of healthcare services for these rural communities and the residents of those communities, but let's think about the types of businesses and the types of things that could serve both the needs of prevention as well as employment and income. We're happy to take questions if we have any time left. Okay? No? I look to other committees. I'm sure I'm expecting that y'all will have some things that we could easily combine forces with on these recommendations. Thank you. Thanks.
Hang in there. We're doing so well. We're doing great on our time. We now have tourism and conservation.